I'd like to welcome folks to Partnership 2019, add my welcome to the ones you had this morning, and happy Digital Health Week. This is Digital Health Week. This is a bit of the Infoway portion of the morning of the leadership session. My name is Shelagh Maloney, and I'm co-presenting with my partner in crime, Lynne. We've never presented together before. So I'm going to start it off, and I'll hand it over to Lynne, and then we'll have time for questions. So what we're going to do is we're going to talk to you a little bit about what we've accomplished in the last year, and a new day in healthcare is coming. Just wait till people get settled a little bit. And I should tell you that we have asked that the temperature in the room be brought up a little bit, so we'll thank you. And after this session, it'll be so hot in here, everybody will be having a great time. How many people were at Partnership last year? Can I just have a show of hands? Oh, awesome. Okay, it was a year ago today that we launched Access 2022. And it's interesting, it's one of those things that you say, really, it was only a year ago? It seems like just yesterday. Or some days it's, well, wow, it feels like we've been doing this forever. So just a reminder, Access 2022 was a social movement campaign that we used to inspire people around a new day in healthcare is coming. And the point of it is that we all need to work together to inspire and transform the healthcare system and do it with digital technology. A new day in healthcare is coming was the theme. So what have we done in the last year? Well, the first bit, and we spent a lot of time, and the focus over the last year was around what we call the hero videos. We developed these hero videos and had a good PR and marketing campaign around them. And we identified 10 Canadians who are really changing healthcare in Canada and developing digital health innovations. And so focusing on them and sharing their story was really about influencing and politicians and decision makers, but also the general public. And so you'll see we've had some articles in the Hill Times, some op-eds in some magazines. I hope you've seen us in some local papers, certainly all over social media. And it was really about getting people to join the movement. And access2022.ca, if you haven't been there, I would strongly encourage you to go. Lots of great videos on there, lots of good stories. We are also collecting stories. If you have stories you would like to share with us, please do. And also join the movement. So we have over 50 organizations, participating organizations, national organizations and associations who have joined the movement, but also almost 2,000 Canadians who have lent their names to say this is an important thing. So if you haven't already done so, especially for us being part of the industry, I think we sort of have a bit of a responsibility and that credibility to tell our family and friends and really get people to get excited about a new day in healthcare and one that's run and inspired and transformed through the use of effective digital health technology. So 3 main focus areas and audiences for Access 2022. And the first one are clinicians. We're also going out to patients and industry. That's the focus for now. And some of you might recognize Dr. Kumanan Wilson. He's actually based in Ottawa, at the Ottawa Hospital, and he's the founder of Can Immunize, one of the subjects of our videos. We're also working with CMA and the Virtual Care Task Force, so we're pretty excited. And what I thought I would do is share with you the video of Dr. Wilson, and so you get a sense of, so I'm doing it because we're in Ottawa and he's in Ottawa, so that's kind of fun, but also to give you an idea of what the videos look like. And again, I encourage you to go to access2022.ca and share videos as well.
I've been studying immunization for over 2 decades now, and I've come across a lot of challenges in issues of vaccine hesitancy, issues of recording data and having accurate information on immunization coverage. Sort of serendipitously, I was having a conversation with a mother in a park one day, and she complained to me about those yellow cards you have in Ontario that you use for storing your immunization records. She said she couldn't keep track of them. She had a couple of kids, and every time she went to the doctor's office, she had to get another one if she forgot them. And she said, if I can do my banking on my phone, why can't you put this immunization record on my phone?
I heard about Can Immunize through people at my work. Immediately it was like, how come nobody's done this before? This seems so obvious, this is great. Nobody misses those yellow cards. Can Immunize app is really simple to use. You open it up, you can create a record for yourself, for your kids, for any other dependents in your family. You click on the vaccines you're supposed to get and you just click on when you got them and you put in the dates. It's really that simple.
We work very closely with Ottawa Public Health, and in Ontario, parents are responsible for reporting their immunizations to public health.
When my son was starting to go to kindergarten, instead of having to photocopy or fax the yellow card in, I was able to just click one button on my phone and it went directly to Ottawa Public Health, and they informed the school that all his vaccinations were fine. To have those kind of things at your fingertips in an app, that's huge for families.
This is the future. Digital technology has transformed healthcare. Maybe the answer is to actually empower people. Maybe the solution resides in giving individuals control over their own health information. I believe that Canada Health Infoway's Access 2022 initiative and Can Immunize fundamentally share the same vision. There really is no option. We have to figure out how we work with this revolution in healthcare.
So that just gives you a bit of a flavor of the kinds of videos that we've collected and some of the things that we're trying, the messages that we're trying to get across with the access2022.ca. The second group are patients. And we all know patients are a very strong voice and getting a much stronger voice, and they have a lot to show us and teach us about how we design our systems and what systems we should be designing, what the priorities and things are. And so some of you will know, you'll recognize David and Terry Price, who are a subject of one of the videos that we did. They spoke at a partnership conference a couple of years ago. So on the partnership side, or the patient side rather, around access2022.ca, I'm happy to make an announcement today, one of the first of two announcements that Lynne and I will be making. So we're just launching today at partnership during Digital Health Week now, a healthy dialogue. And what we're doing is we are going to undertake the largest public consultation around digital health in Canada, is what we hope it to be. We have already done some online focus groups. We will be doing face-to-face focus groups with Indigenous populations. We will do face-to-face interviews with vulnerable and marginalized populations across the country. We also, Environics is helping work with us on this, and they will be doing a national survey with a representative sample in every single province and territory, a representative sample of Indigenous population as well, which we're very pleased to be able to do. And we'll be doing this online engagement hub. So this is where you come in. A healthydialogue.ca. I hope you'll be very familiar with that and go as often as you'd like. A Healthy Dialogue CA is an online engagement hub that we're launching that will give you an opportunity to go and participate in a poll, in a survey, share your story, submit an idea. It's really to get Canadians engaged in talking. And so what we're going to do is we're going to take all this information from all those engagement components that I just talked to you about. What we're also doing in parallel with that is we're looking at what are the technology trends and the other trends that are going to impact healthcare in the next 5 to 10 years. So where we are today, what Canadians want, expect, and hope from their health system, how they're using technology now, how they would like to use technology to improve their health. What are the technology trends and the other trends that are going to impact how we deliver healthcare in the next 5 to 10 years? And then how do we take all this information and what do we need to do and start working on today to help us get from our current state to our future state? What policies, what regulations, what technology, what governance, what issues do we need to address collectively as a digital health community to move the state forward? So that's really exciting stuff. And so today we're announcing a healthydialogue.ca. We really hope that you will go tell your friends, tell your family, tell your Brownie tribe. That was the first thing that came to mind. Your hockey team, your book club, share, please. And again, I think we would love to hear from you and love to hear from everyone else. So that's the piece that we're talking about today. And then the third component of the Access 2022 campaign, of course, is industry. So I'm going to turn it over to Lynne, who's going to share the second nice piece of exciting news for us.
So Access 2022, the movement, and Shelagh talked about the number of people who have signed up for that movement, and we've had lots of industry partners and lots of individuals who happen to work in industry also sign up for the movement. But a year ago at this conference, we started talking about something called the Access Alliance, and again, many of you were here, and we talked about how do we build the working communities around delivering on the promise of Access 2022. And we talked about a program called the Access Alliance, and since then, we have done a number of things. We've done a call to invite some corporate leaders. We were looking for a small group of corporate leaders to really be the voice at the table for the Access 2022 movement. We were looking for companies that were willing to put people and resources on the table to make the movement, make it really sing. And so I'm very pleased to announce today, I'm going to make it work. A big green button is being pressed. Oh, there we go. The Access Alliance 2022 Founding Sponsor Program. And there'll be a press release later today, but the members of this founding sponsor group are the following companies. So these Access 2022 Alliance founding sponsors have committed to work with us on this movement. We had our first meeting yesterday. We have lots of ideas of how a community can come together, the private sector community can come together to help meet some of the goals of the movement. But I want to shift gears now. So a movement is great, but Infoway has to do our part on delivering on part of the movement. It will take everybody in this room, as we talked about earlier, doing all the things we're doing to deliver on this new day in Canada, and we want to still continue to champion a very big picture. But at Infoway, we have a program we call Access Health. And Access Health is where we put Infoway people, resources, time, and money into beginning to deliver on the promise. And of course, our focus is on what we've been talking about more or less all day, which is how to give Canadians more control over their health information, give them access to their own health information, and just more digital health services in general. And so Access Health is actually an Infoway program. And I use the word ambitious here. So it is a little bit ambitious because I don't think we're going to be done by 2022. Ask the marketing person why we got the label 2022. It won't be done by then, but I think we'll be able to make enough progress by then to go back to our partners, provinces and territories of Canada, the federal government, all of the health service providers, the health regions, and to Canadians to get a mandate to keep working through this exercise. It's big transformational change, as a number of people have mentioned today, and we think we're making some milestones and have moved further. So I was here last year telling you a little bit about our ideas, and I'm going to tell you a little bit about our progress. So, like all good programs, they have pillars, and we have 3. And the first pillar is something we call the Access Gateway. And it's really interesting to follow Don Tapscott and talk about the gateway. So the gateway is infrastructure. It's actual services that Infoway is building as we speak. And these are supposed to be enabling building block types of services, dealing with the things that are keeping us from getting all these pilot projects to scale. And we're working very hard on a couple of building block things, and both of them have been mentioned today. So the biggest one is what we call a trust framework. And interestingly enough, trust frameworks don't actually have a ton of innovative technology, but trust frameworks underlie one of the biggest challenges we have when we go to share data. We go to share data, and you need a PhD in privacy and legal in order to be able to get permission to move the data from point A to point B. And of course, in a trust framework, we all agree to a set of rules, regulatory, policy, legislation, and there's a little bit of technology to help with compliance. Others around the world have done trust frameworks, and if we have a trust framework, we think we can execute on the promise of Access 2022. Underneath that is a set of what we call identity services. And Don did a good job this morning talking about the need to give Canadians a stronger identity that they control, that they're able to manage their health information. And right now, we do that in a very patchwork way. So we think that a national gateway that supports a set of identity services can also move us further along. And I'll talk again about where we are in that journey in a minute. The Alliance, I talked about the first Alliance program, our founding sponsors program. But as we move forward and deliver on the Access Health program, there'll be many more opportunities for clinicians, private and public sector, to get engaged in actually delivering this. So there's one thing to be part of a movement, it's pretty important, and the second thing is to actually connect to this gateway and build a community to actually deliver these services. And so we will see some other ways to participate in the Access Alliance as the year goes on. And lastly, we talk about services. So you can build all the back-end infrastructure and plumbing you want. You can build building block services, but if people don't build citizen-facing products and services based on those, then you kind of wasted your time and money. So plumbing is valuable, but we need to actually get these services into the market in 2020. And so you can start to look for really innovative mental health solutions. You can look for virtual care products using these identity services, and we'll even be showcasing some personal health information moving from the public sector sources into some apps and portals and solutions for citizens. Imagine the citizens' immunization data moving directly from the public health repositories into Can Immunize. That's kind of the conversation we're looking to get going. So where are we? Patience? Don't really have patience. Oh, see, every time I do that. Okay, this is my last slide. So getting a little bit real now. So a year ago, I think I did even more hand waving. So now it's a little bit more real. The first Access Gateway services will be available and in use by early adopter organizations in 2020. So we're very excited about Access Identity Services. And for those of you who are here tomorrow in one of our concurrent sessions, you have the privilege of listening to Mario Voltolina, our Chief Technology Officer. He'll talk a little bit more about Access Identity Services. He may even show you a sneak peek of what it might look like from a citizen's perspective to take advantage of those identity services. There'll be opportunities to talk about the trust framework. And of course, under that is what Don talked about is consent services. So again, empowering the citizen with a secure identity, the ability to consent to moving data around, and the trust framework that makes everybody comfortable that they can do that. This is tough, heavy lifting stuff, huge enablers to moving forward with this industry that we've all talked about, and particularly to getting things to scale. We also have an alliance session tomorrow, so you can actually meet those founding sponsors, and you can help us shape all the other engagement models that will fit under this Access Health initiative. I didn't want to get off the stage without talking about our partnership with the 4 Atlantic provinces. We've been working for about 18 months, many of you know, with the 4 Atlantic provinces. So we dubbed it Access Health. I know the Access world is getting a little tired, Access Health, Access Alliance, but it works for us right now. Working with the Atlantic provinces, we've done some deep dives into identity, how to deliver mental health services, all sorts of access-related, how citizens want to receive their data, what it looks like, how would you design for that, how does the government work with the organizations like Infoway and the private sector to get that data out there. So together with the Atlantic provinces, we defined 10 unique initiatives, I think more than 10, some around portals and apps for citizen access, some around proving access to mental health services. So you heard a hint today in our opening session about a service in Newfoundland called Bridge the Gap. It's a fabulous, innovative service, and we're looking at how to productize and scale that e-mental health service right across the country, starting in the 4 Atlantic provinces. So we're going to operationalize those initiatives this year, but there's lots of other opportunities as we go forward to support other provincial and regional efforts across the country, mental health, virtual care, and anything that supports citizens getting access to their own health data. So next year, you'll see identity, you'll see some very interesting new services, you'll see a first blush of a national gateway, hopefully federated with some of the other gateways. It's not the gateway, it's a gateway, and many of you are involved in other gateway projects, and we hope to bridge them all together and start to deliver on the Access 2022 mission. And I'm going to flip it back over to Shelagh.
If you only take one or two messages from this presentation, I think it's to say that we are making progress, we're excited about the things we're doing, and that we need to work together as a number of different stakeholders with all bunch of different types of expertise to bring this together. So we do have about 4 minutes for questions. While people are walking up to the podiums with their questions, maybe I'll also say one other thing is, as Lynne mentioned, there are a number of different presentations and there's lots of conversations. You can find out more about a healthy dialogue. You can find out more about the gateway through some of the concurrent sessions next week. And also there's lots of Infoway people in the room who can answer some of your questions as well. So we've got about 4 minutes. If there are any questions from anybody.
While we're waiting, see anyone standing up, I did have another thought. I was recently involved in a global survey on interoperability. We're part of an organization called the Global Digital Health Partnership, and we have an interoperability working group. We went and surveyed 30 countries and talked about the barriers to interoperability. And I was pleasantly surprised about the outcome from that. So it didn't turn out that we need more standards to support interoperability or more work on privacy to support interoperability. The number one thing was that we need more coordination and collective action from multiple organizations to get interoperability. And I think that's kind of what we've been talking about
There's a
today.
bit of a recurring theme here.
Recurring theme, yeah. And better usability in solutions to support interoperability. So it turns out we can get the data point to point, but we sure can't make it easy for somebody to use that information. So again, Gateway can solve some of the problems, but we'll need lots of innovation on the citizen-facing, clinician-facing tools to make all of this hum.
How many people here have joined the movement who have been to the access2022.ca website? Good on you. So this time tomorrow, we'll ask that same question and we'll expect to double the numbers that we've got. I see we have a couple of our heroes here. Mark at the back of the room, do you want to just wave? One of our heroes in the video. And I think Colin Hung, I've seen him today here. I don't know if he's in the room. There he is, we're over there. So say hello to those heroes and you get a chance to intermingle with them. So no questions, no comments. Again, we're here all week, folks, or for the next couple of days anyway. So we look forward to the dialogue and the discussion. Takeaway, we all need to work together. We can make a new day in healthcare and we can make this happen. So thanks very much.